Everything that you do in medicine ought to help someone feel better or live longer. To me, the kind of medicine we practice helps people feel as well as they can for as long as they can.
People are not dying in America the way they want to. They end up going in the hospital 6 or 7 times. They're in intensive care units, sterile surroundings, tubes in. That's not the way people want to die. Nobody wants to die that way. Yet in Medicare today, over 30% of people die just that way.
Aspire was to me an opportunity to provide care for patients with serious illnesses in the way that they needed it, in the place that they needed it.
Aspire Health is a network of palliative care physician practices that provide services to patients in their home. So whether a patient has advanced cancer, CHF, advanced dementia, COPD, we have nurse practitioners, social workers, nurses, chaplains who go to their home and help take care of whatever it is they need.
Palliative care integrates not just the medical, but also the social, behavioral, psychological components in order to really serve the patient and the family in a way that is much more broad gauge than what typically goes on in the system today.
The whole concept of end-of-life care or palliative care, a team-based approach that focuses right on the patient, taking care of all of these different needs, is one that has not been applied in the outpatient arena, which is really surprising. That team-based approach, developed, applied in the outpatient, is the magic of what we're doing with Aspire.
One of the big opportunities and challenges for Aspire is we're really the first to market specifically in the palliative care space. And so our opportunity is to go partner with anyone taking risks, mostly health plans, Medicare Advantage plans, commercial plans, mostly in the oncology space, and to really provide them a comprehensive solution that works for their patients.
I can think of so many examples where we've helped people feel better and live longer. One man in his 60s with really advanced lung disease, in and out of the hospital dozens of times. We've now got a relationship with him where whenever there's the first sign of a problem, we're out at his home, starting therapy, doing the things that help prevent problems rather than let them spiral out of control. He's more comfortable in his home, he feels better, and frankly, he's safer being out of the hospital.
One of the best things for me about building Aspire in Nashville is I'd never done healthcare before. What's been so great about Nashville and our investors and the people on our board is they've really wrapped around me, and they've really given me the kind of support I need, the kind of experience that I don't have, to be able to really understand whatever the problem of the day is that we're facing.
We created NCN to develop a resource for the community, and so that resource really is this network of angel investors that we put together. They understand the challenges that face early stage businesses, and they're able to not only contribute capital, but also contribute wisdom from their experiences to help build better companies.
Aspire, I thought, was very interesting from the outset because palliative care is a market that is really just beginning to develop. I thought the Aspire model of really being the direct provider of care and also contracting directly with the insurance companies made an awful lot of sense.
So for somebody like Brad to be able to pick up the phone, to meet with, to have mentors, people who have traveled through that same eye of the needle is invaluable.
And when palliative care is delivered well, patients are happier, families are happier, doctors are more comfortable with the level of service their patients are getting, and health plans save money. And there's just so few places in medicine where all those things are true at one time. And I think if we prove that's true, I think our ability to expand into new markets will be extremely opportunistic. And I think we'll have a lot of opportunity. I wouldn't be surprised if we end up in 20 markets in the next 2 years.